Okay.
Okay, Randy, tell me what's going on with your back now.
It hurts.
So, when this started?
Thursday,
Thursday, how did you do that?
I sneezed.
You sneezed. Okay. That's awesome.
I was working. I was just kind of hanging out with a friend doing some project on the table, and I sneezed. And I went, oh, darn it. But I'd known days before, because I've been surfing so much, that it's starting to get tight again.
So you get muscle spasm in the
Yeah.
back. How you describe your pain?
Like somebody threw a baseball and hit me right in the back.
Okay. So is it sharp, dull, aching?
Sharp, isolated, almost feels like a knot in the middle of my back, but then things start to radiate up to my neck. But most of it is like I say, that small area looks like somebody, like I felt like I hit by a baseball.
So, how much pain from 0 to 10? 10 is emergency room.
Oh gosh, no. 7, 8. I didn't sleep well. Every time I rolled over, I woke up.
You feel it in the
because
back.
I felt it.
Okay. So what's tight for you to move? Like what range of motion that's limited?
Just breathing.
Breathing, you feel it with breathing,
Take a
coughing?
deep breath. It feels like it's pulling across my lung.
Okay.
And like I say, it's just uncomfortable. Some movements, all of a sudden that small area feels like bam.
What,
Just
let's
sharp.
move your neck. Let me see your range of motion. The
That
other
actually
side.
feels good to do that for
Okay.
where the pain is. That
Back.
feels good.
So extend your neck back, down. Okay.
It's just tight.
Just so you feel tight. Let's stand up. I want to see your range of motion. Can you? What motion aggravated? What stimulated? You said breathing. What else?
Moving forward. If I've been
Bend forward.
coming back up.
Okay. So let's do that and tell me how much pain with that.
See, now it just feels it's starting to be
Marking your legs.
uncomfortable, uncomfortable,
Let's
uncomfortable.
touch your legs. Okay. Back. How much pain with that?
Uncomfortable. 7.
7. Okay.
It's gonna make the day bad.
Okay. So let's sit here, just facing the camera. Okay, it's gonna feel a little bit cold, okay? So this is the area you're talking about,
A little higher.
higher here.
Yeah.
Is it-
Right.
Is that the scar tissue you're talking about?
Yeah.
You feel that's not? Yeah.
Yeah. When it goes
It's
higher.
a muscle spasm. Goes up to your neck. Is it okay to take your shirt off?
Yeah.
Okay. Okay, I want you to sit here. Okay, let me know if you feel any discomfort, okay? So it's going more toward your neck than going down to your
Yes, true.
to your back. Okay, to your hip. Let me know if you feel any pain with that. So how many days you surf per week now?
As many as possible.
Mm-hmm.
Sometimes 7 days?
Not usually. I'm too old. Usually I have about 3 or 4 days. I gotta take a day off.
Yeah. You usually take a day in between.
No, I usually wait till I can't do it anymore.
Oh man.
Like
You
today.
You go in the mornings?
Yes.
Until you don't get sleep at night.
Yeah, until I can't sleep at night, the next morning's not gonna be fun.
So come see us.
Should have been here last week. I wouldn't be in this position. Yeah, that's just tight up there. Right there's where the worst is.
Right in here.
Oh no, down on the right about there.
Okay. Right, so I'm gonna work on the scar tissue there. So let me know if you feel any discomfort on that. Okay? Gonna feel cold. This is different than what you're talking about. You said it's around here, yeah?
Yeah, but it's all the way up.
Yeah, you have several ones.
Well, that's the only one I can actually feel bad
Feel
about.
it with breathing, yeah? Or coughing, laughing,
Sneezing.
sneezing, okay.
There's not much to laugh about when your back feels like this.
Yeah, sometimes people, when it's affecting the movement of your rib cage, You can feel it with laughing or sneezing or coughing. Do you really have a big one? Yeah, actually too. It's probably what you feel it in your neck.
Ah, right there.
Is that painful?
Yeah,
It's
no,
okay.
it feels wonderful.
Okay.
That was where the knot is. That's the one that bothers me.
Yeah, this is-
The others feel just as big, but that one bothers me.
Well, that's why you say you have some restriction with your arm going upward, because it's actually pulling your scapula downward.
That's what it felt like.
So, yeah. It's not too bad here. Let's go here. Can you tell a difference in your breathing now, or you still feel tight?
Definitely have relief.
Okay. Got a big one here too. Feel this one?
Mm-hmm.
Okay. All right, so let's actually move your neck and tell me how that feel. It's nice. It's a little bit limited here.
The
So
right is better. Left is-
where do you feel the tightness when you go to the left?
Actually pulling from the left to the right for some reason. You
So,
should, yeah, from here back.
yeah,
Yeah.
I'm gonna not here. Okay. All right. What about the breathing now? You feel it or it's gone?
More better.
Mhm.
Much better. Still feel a little bit, but much better.
Okay. Let's bend forward and tell me how that feels. I'm not gonna clean the lotion now because I'm gonna continue doing more. How's that? Oh, you're touching the floor now.
It's better, but it's still there.
You still feel it in
Smaller.
the same spot?
Same spot,
Okay.
right between the shoulder blades.
So let's have a seat, the same position. Well, you have a scar tissue on the other side too.
Might be
And
affecting it.
yeah. And here. Yeah, can you tell the difference here in this side
Yeah.
compared to this?
A little bit.
Yeah. You're right-handed, are you?
Yeah.
Okay, so when you surf, you use your right hand more?
I don't think so.
Yeah.
When
Or when you
my
do some
stand up paddling the right side.
Paddling more. Yeah.
The right side stronger.
That's probably why you have it here. Let's take this here. Is that too much or is it okay?
No, you stand on it for all I care.
No, I'm not gonna do that.
No.
Not in the front of the camera. We don't do standing.
Camera off, you're gonna stand on my back.
Yeah, did you see that massage for the standing massage?
I love those.
Oh my goodness.
I love it when someone walks on my
Yeah.
back that doesn't weigh 250 pounds.
Yeah, yeah. Yeah, I don't recommend it to people, so.
Oh,
Yeah, hopefully they don't break anything.
my wife is tall. You've seen her. I love that. Feels wonderful.
All right.
That might be part of my problem.
Yeah, you are in the wrong place now. We're not gonna
No,
do a
it
standing massage.
might be why my back hurts. She won't do it when it's sore though.
Yeah.
She refuses.
Well, just make sure if you're gonna do that you have health insurance and just put us on speed dial.
There, come
Okay.
on now.
Let's move your neck because it was tied to the left. So let's see. It's beautiful.
Go
How's
better.
that? Yeah, go
Go better.
further. Okay. What about the breathing?
80% better.
80%
Still,
better.
that thing has gotten
Shrinking a little
smaller.
bit.
Yes.
Okay, so let me clean that. I'm gonna do a couple of things there. and gonna feel cold, okay?
Okay.
And I will have you actually, after I finish, to cough, just to do another test to make sure it's totally loosened up, okay?
Okay.
Okay, you're gonna feel cold.
You said that's not cold. Come on now. You
Um,
promised me cold.
yeah, we'll get some ice next time. You feel it right here, yeah?
A little higher.
In here, yeah?
Right.
Yep,
There.
squeeze your shoulder blade together. Squeeze it, squeeze it. And relax, let it go. Let's do it again. Squeeze it. And relax, let it go. Shrug your shoulders, up, 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 up. And relax, squeeze your shoulder blade together. And relax, let it go. Okay, so let's breathe and tell me how that feels. No difference.
Substantial.
Okay, so if 100% back to normal, where are you now?
Close to 90.
90%? Okay, let's move your neck and tell me how's the range of motion now. This is perfect.
That is much better there. I have nothing there.
Okay, so no
Yeah.
tightness?
No, the tightness was coming down through my traps before. It felt like
You don't feel it now?
nothing there.
Okay, let's stand up. I want you to bend forward and see how that feel. Going down, because you said it was bothering you going up. You're touching the floor now.
Well, it's not that far away.
Yeah.
Like I said, that thing's gone from that down to this.
Just a little bit, okay.
Yeah.
I don't want to cause bruise there, so we'll come to a little bit more next time.
Okay.
But the pain is subsided.
Yeah, I'm gonna be able to enjoy the rest of the day.
All right, awesome. Thank you so much. Thank you.